Obi's right there if he farts.
Greetings, friends. This evening we're going to talk about the ribs. So our first case is the case of an 85-year-old in the hospital with pneumonia. Cough, cough.
I'm an 85-year-old in the hospital with pneumonia.
So we can actually perform many useful OMT techniques on hospitalized patients. Even your patients in the outpatient setting who have pneumonia can benefit from rib raising. And so what we're going to be doing with this technique is we'll start at the 12th rib, work our way up between each rib, increasing the space between, basically increasing the capacity of the lungs to expel the bacteria that is in there with pneumonia. So the first thing that we're going to do is I'm going to have you put your feet over here. And the book shows a different technique, but I find this to be equally as effective if a patient can sit upright. So you're going to cross your arms together like this, good, and put your head down, perfect. And then you're going to rest their elbows right here on your shoulders and encourage them to lean into you like this. So if we palpate down to his 12th rib, which is right here, and we're going to incorporate some breathing into this technique. So big deep breath in and out, and exerting pressure each time moving up between one rib space. Big deep breath in and out. Good. Big deep breath in and out. Big deep breath in and out. Big deep breath in and out. Perfect. And so you move up each rib until you get to the top. An option for hospitalized patients who can't sit upright is go ahead and lay down on your back with your head this direction, please. Is you can have the patient laying down. You can go ahead and palpate to the middle of their thoracic spine. Big deep breath in and out. And you extract the ribs laterally. Big deep breath in and out. And then you would do that on both sides to get proper rib raising. Hey, Stacy.
My name's Stacy. I'm a 40-year-old woman with upper cross syndrome.
Do you work at a desk job with poor posture?
Yeah, that's why I have upper cross syndrome.
Where is your pain?
My back and my chest and my neck.
That sounds like upper cross syndrome. Let's talk about upper cross syndrome. Upper cross syndrome is characteristic of most people who work at a desk job with poor posture. So if you think of a person with a posture like this, you're shortening the scalene muscles, so they're hypertonic here. And then the trapezius is also dysfunctional, and where all these muscles attach to the first rib also makes the first rib dysfunctional. So, as this is a very common condition that you'll see in a lot of your patients, characterized by cervical pain, upper thoracic pain, also sometimes some just anterior chest pain where their pecs are, you can, after diagnosis of exclusion, call it upper cross syndrome and treat them with OMT. So we will do some first rib HVLA. We'll also do some inhibition of the scalene muscle that connects from the and then also work on the upper back area with some soft tissue techniques. All right, Stacy, go ahead and lay down on your back. Put your head on this side right here. So we're going to palpate the first rib, which can be palpated if you go in between the clavicle here and then move about an inch back, you'll feel that divot there. That's where the first rib lives. And so it can be kind of tender when you touch in this area. And with Stacy, I feel like when I'm really palpating the first rib on the right side, it seems to be more elevated. So that's going to tell me that that's the dysfunctional side. So with that, with the HVLA, I'm putting my left hand right in there where the elevated first rib is. Relax your arm and really let their arm go limp. And then we're going to do a circular motion. There we go. And I felt a nice release as we did that. Stacy, how does that feel?
Feels great.
Awesome. So the next thing that we're going to work on is the scalenes, which attach to the first and the second rib. So if you palpate down where the first rib and the second rib attach, you'll feel the origin of the scalenes. And right there it might be tender again, so ask for your patient's feedback. Is this okay pressure right here?
Yes.
Okay. And we're just going to apply a lot of direct pressure to that point. Big deep breath in. And out. And in. And out. And you would do the same to the opposing side as well. Big deep breath in. And out. And in. And oftentimes with individuals with upper cross syndrome, you're going to find that their scapular region is pretty tense as well. And in that case, it would do some inhibition on the scapula, kind of like when you initiate Spencer technique.